All right, Chapter 11, Poisoning and Substance Abuse. Now, a poison is any substance, anything at all, that causes illness or death when eaten or uh, drank or inhaled or injected or absorbed. And it doesn't have to be in a very big quantity. It can be small, little pieces. So a poison is anything that is going to cause harm to the body. And it is the EMR's job to recognize these poisonings and treat them very promptly in order to counterbalance them or at least keep them alive long enough for the ambulance to get there and take them to the hospital. Now, there are four main ways of getting this into your body, poisoning it into the body. So you need to know these. These are something that is non-negotiable. You'll need to know this whether you're going to stay in EMR forever, which is awesome, or if you're going to go all the way to be the super father of all medicine, all the way up. So the four ways to get in are ingestion, inhalation, injection, and absorption. Ingestion means it goes through the mouth and into the stomach and absorbed into the digestive system. Okay, ingestion. It's got to go. I got to swallow it. All right. Inhalation is where the poison is breathed in. I suck it in through gaseous forms or particulate forms, and I breathe it in and it hits my lungs basically. Injection is it gets punctured in. Now that also could be um, uh, stabbed in, but it could be like in the form of a needle or a knife, or it could even be something even more sinister as you're talking about other weapons. Absorption means it is in contact with your skin or mucous membranes, and this, typically when things get on, you're spilled on, right? Or any of those type of things. So ingestion, inhalation, injection, absorption. Those are the three methods of getting poisons into the system. Incidentally, that's the same routes, if you will, for medicines to get into the body. And incidentally, it's the same four methods for getting an allergen into the body when we talk about allergic reactions in the future. Obviously, what we're going to do here is we're going to do our scene size up, primary assessment, history taking, secondary assessment, and reassessment. We're going to do this for every patient. You have to know this, right? We're going to do this every single time. So if you're questioning what you need to do, why don't you head back to the previous chapter, chapter 9, and take a look at that again. This is going to be, along with your vital signs and sample history, this is your bread and butter play here. This is where you start. However, for this one specifically, we're going to start with a little bit more about um, scene safety for us. Are we going to be exposed to this? We need to look for clues of what the poison might be. Look around for bottles or needles or whatever, containers of any kind, okay? We have to really know what's going on because this could cause a problem for us. So we have to really be paying attention to the scene in this instance. Uh, how long ago did it happen? What's the history here? Do they have a history of doing this before? Have they been in a bad situations before? Respiratory. What is their breathing like based on whatever the poison was? Because remember, without a respiratory system, we're not going to have much of a human body very long. Are they nauseous? Are they vomiting? Do they have diarrhea? These will be leading us to clues, and this is obviously in response to their poisoning, as to what's going on. Are they conscious, unconscious? Are their pupils moving, not moving? Are they having seizure activity, convulsions? Are they sweating? Are they cyanotic? These are the things that we need to look at when we're doing a patient assessment from an outside view in as we drill into this. And just some facts on poisons. Nearly 71,000 of drug overdoses in 2017 in the U.S. 71,000 people uh, basically, well, they didn't basically, they did die, right? And in 99, there was 6.1 drug overdoses per 1,000. And now we're up to 21.7 per 100,000. Sorry, I said 1,000, not 100,000. So you see, this is getting worse. It's not getting better, it's getting worse. And think about this. Where do we live? We live in Van Buren County. Now, we're starting to see an increase, an uptick in a lot of narcotic abuse, but typically speaking, we're the meth county. At least that's my experience over the last umpteen years. Actually, not umpteen years, like 20 plus years. Is we have a bad meth problem in the area, along with all the other drugs. Although now we have marijuana that is now legal, so that's very helpful as far as we want intoxicated and people that are going to have some issues that way. So ingested poisonings. Think about this. More than 80% of all the poisons are caused by eating it in. Now I'm thinking specifically right this very second of marijuana overdosing. Now I know, well, that really it can cause you to be sick, and especially gummies and brownies and things like that. You know, you don't know what you're putting in your body sometimes because people think that it's funny to cause other people to be and have problems. You know, evil loves to cause havoc. Sorry, I soapbox there for about 2 seconds. Uh, if they eat it in, we need to be looking at their mouth, right? Do I smell any chemical burdens or odors? Is there stains or things that don't make sense on their face? Um, Now this is going to be for like, and this is more of the poisons than the overdosing. Uh, if someone is overdosing by drinking something in, so you have a mental issue going on here where they're mentally compromised. Maybe they are suicidal. If that's the case, make sure you have law enforcement rolling to you. Okay. Well, what do you have as signs and symptoms? And remember, we're not here to judge. We're here to help. If we can, let's identify the poison and give Poison Center a call. Uh, because typically speaking, most of the local hospitals, that's what they're going to do anyway. Um, if you can't contact med control, you can go ahead and dilute it with water. My dad used to say when he was doing his trainings, the solution to pollution is dilution. So we're going to put some water in there. I'm not real crazy about giving stuff by mouth, but it is an option if you can't get National Poison Center online. Okay, these people need to get to the hospital as soon as humanly possible. Um, it is not something to be trifled with because we need to get that whatever it is in their stomach out. Now we do have some activated charcoal that we can assist with, or not assist with, we're going to give it to them based on our local protocols about, and this is keeping the whatever's ingested from being digested. Okay. Now the kicker here is it can't be if you have anything that is too acidic or basic. Well, how do you know what that is? Well, Drano is very basic, right? Battery acid, very acidic. They're trying to kill, if they're ingesting these things, they're probably trying to kill themselves. So we have to be thinking about that. They're probably trying to commit suicide. But also, if it's a petroleum based, these things, if I was to put activated charcoal in there, all that's going to do is bind with it and keep it in there. So it's not going to be, we don't want it to bind with it and travel through the rest of the system because it'll melt your system as it's going through there. The human body operates in a slightly basic 7.35 to 7.45. I'm sorry, I said it wrong. Slightly acidic, 7.35 to 7.45 on the acid base level there, on the acid base scale. So anything that goes outside the realm of our body systems is not good for us. And so, therefore, if I ingest something like that, uh, it's got to get out, which means I've got to get to the hospital because we don't do vomiting on scene. Uh, that is an old method that actually causes more damage because if they throw up and then aspirate some, now you got it in the lungs as well. Obviously, you can't give charcoal if, in fact, they're unconscious because they have to be conscious. So when would I give this? Well, I took a bottle of pills. Okay, I took a bottle of, or a, you know, yeah, that'd be about the thing. I drank um, a bunch of NyQuil, like 4 or 5 bottles of NyQuil. I don't know, something along those lines. The dose is 25 to 50 grams for an adult patient and 12.5 to 25 grams for the pediatric patient. Okay, basically it's 1 gram per kilogram, and so roughly speaking, those are the doses. We don't really want them throwing up because if they're throwing up again, it may cause an aspiration. Uh, you'll hear some old wives' tales of well, we used to do serpivipacac on the ambulance a long time ago, yeah, but that induces vomiting. You can still buy serpivipacac on your shelves there at Walmart or Walgreens or wherever, but it's not considered a treatment plan anymore because we don't want people vomiting. Next up is the inhaled poisons, right? So I'm breathing something in. Now the most common inhaled poison is carbon monoxide. It doesn't really bother people until they're dead. You might get a headache from it. You might start doing some vomiting, but you could be confused with a common cold. But the thing here is carbon monoxide binds with oxygen or binds with your red blood cells far easier than oxygen does. And so, therefore, if there's carbon monoxide in the air, chances are you're going to bind with that very quickly and it'll block you from being able to carry your blood cells to carry the groceries to the cells that should be carried and pick up the other stuff, right? Other toxic gases, you'll see them rolling down the road on the highway. Chlorine gas and ammonia, very, very, very bad stuff. You also have oh, I just blanked on it. Well, there's plenty of industrial gases that are rolling down the roads. Make sure you're using your hazmat guide there to make sure that you're not being exposed to anything. Uh, this is easily avoided by not rushing in where angels fear to tread. And remember, your N95 is not going to help you against uh, gases. It's a particulate mask, not a gas mask. And hydrous ammonia was what I was just trying to come up with in the last slide. Signs and symptoms of inhaled poisons: they're going to be dizzy, they're going to be difficult breathing, coughing, headache, hoarseness. They could, in worst cases, become confused. And because they're not getting oxygen in, that's going to cause chest pain because the heart's going, hey, I'm not getting oxygen, I don't feel good. So we got to be thinking about those things, okay? With the carbon monoxide specifically, we see this most commonly with a failing furnace or a heat source other than electric heat in houses. Okay, we also see it in smoke of the burning buildings, and uh, it builds up. It takes a long time for that to clear out of the red blood cells. In fact, you have to, in worst case scenario, you go into a hyperbaric chamber, and you're super saturated with oxygen, and it pushes into your body. Okay, and so to push the carbon monoxide off. So you really don't want to be messing around with this stuff. If you think you're dealing with an altered atmosphere, then stay the crap out of there. Probably the worst one that I saw was when the power was out years ago. We responded to a possible carbon monoxide. We get there and there's a generator running on the enclosed porch attached to the house. Well, right there's your problem. The exhaust was going into the house, and we had one unconscious on the floor. We had one on the bed vomiting all over the place. The dog is what tipped off the problem because the dog was acting funny and throwing up, and the son came home from work and noticed his mother and sister were not doing well, and he was in there trying to get them up and awake. Wasn't able to do that, but left the generator running, not thinking that that was the problem. There was lethal atmosphere in there, 900 times the safe amount. So it is nothing to be playing around with. Again, carbon monoxide, headache, nausea, disorientation, unconsciousness. You see that flu-like symptoms, right? I don't feel good. I got a headache, and it's a little hard to breathe, but I feel better during the day, and right. So one person in the household having this problem, not a big deal. Multiple people in the same household, that is a big deal. I had a class years ago. I think it was my first EMT class. One of my students was saying, I feel bad when I'm here or at home, and when I get out and about, I'm feeling better. And everybody else in the house said the same thing. I'm like, red alert. Get out the house right now. Call them, get them out of the house right now. And sure enough, the furnace had faulted and they were being poisoned. Let's talk about irritants for a minute. Now, ammonia is probably one of the most commonly used things, especially in agriculture. However, and in cleaning. However, it is very toxic in concentrated doses. I'm thinking of anhydrous ammonia, which is very potent. But think about this: if you're using Mr. Clean and bleach, you could have some gases going on there. Some mustard gas, basically, is what you made. If you're cleaning with both those devices, I did that at one of my stations years ago, before I knew this stuff. I was cleaning the porcelain and I was using the different things. I looked over and I saw that the toilet was smoking because of the thing, and I just flush. Solution to pollution is dilution. We need to make sure that anybody entering the area is wearing SCBAs, much like we see here in this picture. Now, this is a problem. We don't want to be. This tank is used for agriculture, right? And they use it for fertilizer and making things better. And that's totally fine. And the way they spread it out is fine. But with a leak or a problem, we need to get a special team in there to take care of it. You might be part of that team. Maybe you're not. In either case, you need to call the people that are supposed to be taking care of this. Obviously, we'll find chlorine around swimming pools and water treatment plants. And again, it's severely irritating to the lungs and the upper respiratory tract. It can cause burns to the skin. So again, anybody entering a chlorine atmosphere, a concentrated chlorine atmosphere, should be wearing an SCBA and the Tyvek hazmat suits. Not just going in there with, hey, I got a mask on, I'm fine. That's not going to cut it. These placards are used to identify methyl bad stuff, right? So make sure that if you respond to the highway or any accident scene and you see one of these vehicles and they're leaking, look it up in your guidebook there. What is the chemical and how far back do you get? If you look over there on the 1824, the higher the number, the worse the hazard is. Okay, but you can see here that's a corrosive. They give you a little picture of how corrosive it is. It eats through metal and eats through skin. It's also highly flammable, the 1268. Now this might be a multiple storage container vehicle that is transporting all these things, or maybe this whatever this is has multiple issues that could cause these things. You see the fire; it's very flammable. It's very acidic. We want to stay away from all this stuff. If I have somebody that's been exposed to inhaled poisons, we have to get them out of that area. Again, we're not going to go rushing in there. If you see 2 or 3 people down in the middle of nowhere or in any room, I would be cautious about entering that room because maybe we have a gas issue going on in there. And me entering that room without the proper PPEs could arrange for me to be in what we like to call in a compromised state as well. But if we can get them out of there, or if fire brings them out to us, we need to get them out of there. I would very much begin breathing for them, but I would not, in any circumstance, lay lip lock to them because I could get contact contamination from the poison. At the very most, or least, I should say, I would not be breathing for these patients unless it's with a mask that I'm doing it with. I obviously carry a BVM even in my personal EMR kit because I am not laying lip lock on people. All right, let's go to injected poisons, things that are stabbed in. Now, we've got animal bites and stings, obviously, are one of those things, but another one of those things is a toxic injection. Now, that could be a medicine that was administered. It was the wrong medicine or the wrong dose, or maybe you're allergic to it. But in any case, it is punctured into you. Okay. Obvious injury site injuries. I could see the holes from the needles or the fang marks or the bite marks. There's going to be tenderness there. I might see even red streaks radiating towards the armpit, towards the groin, because what's going on is it's going back towards the core, right? It's following the blood flow back up to the body. There might be weak, dizzy, local pain, possible of itching, especially if it's something that can cause that. So we got to be mindful of all these signs and symptoms. What am I going to do for them? Especially if it's a sting or a bite. Well, number one, keep them calm. I'm going to wash the area with soap and water. I don't know if soap and water because we're trying to wash it away. We're not trying to sterilize them. I'm not going to hit them with my hand sanitizer because that's not going to do anything except cause pain because they have an open wound. But soap and water and rinsing that out is going to be a good thing. If I can get the stingers or the pieces out, if they're left behind, then I do that, making sure not to cause additional damage. If it's swelling, maybe I give them an ice pack to kind of reduce that and cover some of that pain up. And then again, if it's an allergic reaction, we have to switch to our allergic reaction stuff that we haven't talked about yet. As we move into an anaphylaxis type of moment, I guess it is that we're going to talk about it in this chapter here. As we talk about anaphylaxis, it is a life-threatening allergic reaction. Right? You're going to see itching and hives, the welts on the skin, swelling. You'll start hearing wheezes in the lungs, and it's going to get worse. So if they start doing this, we need to start thinking about what's our counter agent for this to help them out, right? Number one, it will be giving them oxygen and supportive care, obviously. But we want to keep them from going to unconscious level if we can help it. Signs and symptoms of anaphylactic shock. The pulse goes up, the blood pressure goes down. Breathing is going to be altered, most likely towards the rapid side, because your respiratory tract is trying to breathe out the problem. And in worse cases, we go to cardiac arrest. Our number one things that we do for these people that are in anaphylactic shock, they're allergic to something, the life-threatening problems, is we maintain the airway, breathing, circulation, give them oxygen, treat for shock, and if we have it available to us, we're going to pop them with an EpiPen. If you can, if it's possible, get the allergen, remove it. Maybe you have to rinse it off. Maybe you have to scrape it away, whatever it is. You're going to monitor the vital signs and make sure that they don't progress to the point of cardiac arrest. But if they do, you need to start your CPR protocols. Again, if the patient knows that they're allergic to something, have an anaphylactic reaction to things, bees, shellfish, nuts, that type of thing, then they may have an auto injector, their own auto injector. Uh, if they have that, then you can assist them with that, depending on our local protocols. For us here, we have to call into the hospital, but we are then authorized to assist with that. So that might be something that you want to very rapidly take a set of vitals, call into the incoming transport units to let them know what's going on, so that they can call for orders and get the EpiPen into them as soon as humanly possible. And when we talk about snake bites, um, in Michigan we do have the Michigan rattler, and it is a very mild poison, but they do have venom, right? In the country, we have rattlesnakes and cottonmouths and copperheads and coral snakes. These are critters that will, when provoked or whatever, they will attack by latching on, and they take their bite and they just kind of grind it into you so that all of the poison from their fangs comes out. Now, a fair amount of the bites from a poisonous snake are dry bites because they've already used their venoms on other things. But we don't know that, so we're going to treat it very, very seriously. We're going to wash the wound, soap and water, light covering of dressing, and we're going to go ahead and put some ice pack on that and supportive care. Keep the wound below the heart. We don't want them to travel as much as possible. Immediate pain at the site, especially for poisons. Um, they make faint. Emotional shock is not actually a word term. We don't call it emotional shock. We call it psychogenic shock. So, psychogenic shock, sweating, nausea, vomiting, and then left uncontrolled, then we go systemic shock. Now we've got maybe some septic shock developing there. Coral snakes are the worst. Um, in addition to what we already know, we have respiratory difficulties, slurred speech, paralysis, coma, and seizure. Uh, those are for the warmer climates. The coral snakes don't reside in the north. Keep the patient calm and still. Have them try to relax. Gently wash the area. We already talked about this. If the bite occurred in the arm or leg, splint it uh, in such a way so they don't move it around and they don't play with it. And then arrange for transport to the hospital. Uh, there's not anti-venom stocked at hospitals, so they would have to call it in and get that coming towards them. There is medicine that can counterbalance this. Some hospitals that have a high density of snakes in their area might carry it, but I can guarantee you that nobody in the area here has anti-venom. All right, and the last of the poisons is absorbed poisons. Now, those occur when poisons enter the body through contact with the skin or a mucous membrane, and they kind of absorb in, right? The most common are insecticides, and our farmer friends are the ones that have these problems, or people that are trying to steal the insecticides. Um, Toxic industrial chemicals. We have a lot of like Pfizer and Charles River and all these places have a lot of chemicals there, and if they don't do things right, you could be exposed. We might see traces of the powder liquid on the skin. If that's the case, we rinse that away, right? But that area is probably going to be inflamed. It's going to be red and itchy and angry looking, right? Chemical burns, rash, burning, itching, nausea, vomit, dizziness, shock. You see, this list kind of looks the same, whatever you're talking about, through the poisons. It's the same way with the allergens, right? Or overdoses, or whatever this is. Anything that's bad for you is going to cause you to have some of these same signs and symptoms. Want to make sure the patient's no longer being in contact. For instance, if I'm a farmer and I get some of this chemical on my clothes and it's continually absorbing in, or I got gasoline on my clothes and it's continually touching my skin, I'm absorbing poison. We got to get that off. So strip them down, cut the clothes off, whatever it was. Uh, Dry chemical, we want to brush away as much as humanly possible. Okay. because dry chemical may react with water. But as soon as we brush away everything we possibly can brush away, then we want to just run water over it continually for about 20 minutes. So, like if I'm doused in powder, I'm not going to just, hey, let's just rinse off. No, I want to brush off as much as humanly possible. Then I'll rinse off, right? And we'll need, for this instances, if we have a huge problem here, we're going to need to have fire slash hazmat out there to back us up. If EMS, the transport units are delayed, we need to contact med control, or excuse me, poison control. That what is it? 1 2 2 2 2 2 2 2. It's like two all. It's either 221 2222 or 1222 122 222. You can look it back up. Go back to that first slide. Obviously, treat for shock, monitor airway. Remember, we have the big five that we can do things, right? Establish and maintain an airway, provide for high flow oxygen, bag them if necessary, position to comfort, immediate transport. All right, nerve agents. Okay, something that we didn't used to have to talk about unless you're in the military. But as we come into terrorists and bad people, either domestic or foreign, we've got things that we got to think about. Nerve agents are deadly. Small quantities can kill large number of people. Now moving into cardiac arrest within minutes of exposure. So if you come into our area and there's many people laying down and they look to be unconscious and responsive, you're in the wrong place without proper PPEs on. Nerve agent is nothing to mess around with. Some common agents, and I don't pretend to know anything about these other than their methyl bad stuff kill you dead right now. You have the sarin gas and these other nerve agents. We don't want to be messing around with it. But we do have organophosphates that will cause some of the same problem. Organophosphates, that goes back to our farmer friends. Organophosphate poisoning and these common nerve agents are going to be causing what we like to call sludge. Sludge symptoms. Sludgeum symptoms. They have added actually one more now. Sludge symptoms. If you see people doing this, you've got a nerve agent problem going on. Again, the most that we'll see probably is organophosphate poisons, which is going to lead me back to like the agricultural stuff. But sludgeum. This is a great thing to remember. Are they salivating and sweating? Are they lacrimating, meaning are they tearing up? Are they peeing themselves? This isn't like I have to go to the bathroom. This is they can't control it and they've peed themselves. Urination. Defecation. Drooling, diarrhea. So this is all kind of, you're seeing brown stains coming out of them. They're complaining of upset stomach and cramps. They're throwing up. They're muscle twitching or meiosis, which is pinpoint pupils. Basically, the body is weeping. The body is trying in any way, shape, or form to get that thing, that poison out of their system. So it's sludge, salivate, lacrimate, urinate, defecate, gastrointestinal issues, emesis, muscle twitching, right? So if you see anybody doing this, you can be fairly sure that it's organophosphate / nerve agent. If you don't think, if you're in a non-agricultural area and this is going on, now I'm going to lean towards the terrorist type of attack. What's going to go on? Shortness of breath, but the heart rate slows down. This is why they would go into cardiac arrest eventually. The heart rate slows down and you start twitching and as well as being paralyzed. So now you can't even call for help. Slurred speech and seizures, once they lose consciousness, that's pretty much the end of it. You need to be safe. You need to keep yourself, your fellow rescuers, and other bystanders from being contaminated. Those people that are down, you cannot help. If you try, you will be down as well. You're going to make the matters worse. Hazmat teams got to go in there and take care of that. They need to be in SCBA and encapsulating suits, and then they're going to decontaminate them before they even bring them out to you. If it takes any length of time and it's been a severe exposure, chances are you're not going to be able to do much for them. What am I going to do? Well, I'm going to assess for and support ABCs. Now we do have ability of activating Chemtrek, and that has duodote antidote kits. Some agencies carry them with them, and it's an EpiPen-looking device. And these duodotes contain atropine and peroxidine chloride. The atropine keeps your heart rate up, and the other one, the chloride, keeps your respiratory going. Right, so that's why it's a duo. These two things keep you moving, keep you alive, counterbalance. It's a antidote. There are different kits out there. Some of them they used to have them in the syringe format, where you mix the medicines. The last ones that I've seen though are the like the auto injector, like the EpiPen. All right, so we've talked about poisonings. Now we're going to get into more of the overdose things, the overdose emergencies. Look at that. 9%, a little over 9% of the U.S. population of 22 million people have used or abused drugs or alcohol. To me, that is just a crazy high number. I mean, I would think 0.1%, but no, it's 9+%. And so when people are overdosed or abusing substances, it's even easier for them to have other problems that are going to pop up. It could be trauma because they're driving and they cause an accident and kill 3 people. They're probably going to be fine. Uh, Statistically speaking, the people that are drugged up are the ones that survive, which is kind of crappy, but that's what happens. Traffic fatalities, 31%. Oh, good Lord, I didn't know these numbers until I'm looking at them now. 31% of traffic fatalities. Are you kidding me? 50% of murders involve alcohol. 33% of suicides involve alcohol. Holy cow. Can you can you believe these numbers? Well, I'm not an alcoholic. If you can't go without a drink, then that person is an alcoholic. You got to be careful when you're evaluating these people because the people that are so drunk they don't remember what's going on. These are the people that are dangerous because they can flip a switch in a minute, in a second, and they're going to attack you. They could possibly attack you. Um, Try to bite you. I've had that happen. Um, Try to fight you, depending on the level of drunkenness. That might be funny or not. But we've got to be very careful with alcohol because it is not something to be trifled with because it acts on the central nervous system and it just causes everything to go out of whack. Very addictive. It's a depressive drug. It slows everything down and um, it really causes impaired judgment. People coming out of the alcohol addiction have severe withdrawal symptoms. We call them DTs, delirium tremens. And the thing with that is they get to shake it. They get to, they're restless. But they also have the possibility of seeing things, of hallucinations. Okay, now I've got somebody seeing pink elephants. I mean, we hear the stories of the old time where the detox things and they're seeing things and they're hearing things and they're not there because their brain is resetting. It's purging the alcohol from their system. DTs are very serious because the body is totally out of whack and can't take care of itself. These people do need to go to the hospital so they can be cared for. Now we could spend 100 hours or better just talking about the different types of drugs that are out there for people to use. You got needles and lines and razors and this is and that. It can go in any way, shape, or form, ingested, inhaled, injected, absorbed. I mean, you can do any of those things. And we have to kind of start our assessment with what is going on here. And we have to be safe, especially if there's sharp, pokey things there. I don't want that sharp and pokey thing going into me because I don't want an accidental dosage to me. So I want to make sure that I got my gloves on and that I'm being very, very uh, purposeful in my movements. Well, let's start our talk with amphetamines. They stimulate the central nervous system. Central nervous system being identified by the CNS. Central nervous system being your brain, spinal cord, right? And here's some common names for those things. But amphetamine use, you see people that they're agitated, they're wiggly all the time, they're irritable, they're talkative, they're awake all the time, right? Um, there are some countries that actually dose people. They allow them to have methamphetamine, so that they can get more production out of them, and then they give them the weekend off without meth, so they can sleep all weekend long, reset their body so they can be dosed again. But when we have amphetamines on board, and it's not just meth, right? You've got all these other things, and it is a chemical that's not supposed to be in the body, and the body is going to rebel against that. Um, so just be careful of that. Well, we want to keep them from hurting themselves, but I don't want to be hurt either. Then you have the opioids, the pain relievers. Now these ones here, the hydrocodone, which is Vicodin or Oxy, morphine and codeine, these things do have an antidote, and we call it Narcan. We carry that with us and can administer it. But if people paid for this high, they might not be appreciative of you breaking that high for them. But we might have to because it slows everything down. You're going to have pinpoint pupils, weak pulse, low blood pressure, and it's going to knock out their will to breathe. Okay, blue nails and lips, drowsiness. They're going to slip into that coma range. And again, if this is going on, if you're seeing this, hit them with some Narcan, otherwise known as naloxone, and it is almost immediately. It almost immediately reverses this opioid overdose. If they're not breathing because of the narcotic, they start breathing. It's amazing to watch. And typically speaking, we give it intranasally. Any responder that's not a paramedic gives it intranasally. And it goes up like this. Right here we see one that has an aerator on it, and this is a 2 cc syringe. And we are authorized in this county, in this state, to give Narcan because we don't want people to die. So up the nose it goes. It could be an accidental overdose. It could be a purposeful overdose. We don't care. But we are going to get the Narcan up there. There's also an auto-injector one where it just kind of, once you activate it, it shoots 4 milligrams up there. In this situation here, we'd like to do 2 on each side, just kind of spread it out. This is an absorbed antitoxin. We have standing orders to do this. Law enforcement, fire, EMS have standing orders to do this. Now, if you go to another state, they might ask you to call in for orders to give Narcan. But when you're given medicine, whatever it is, you need to do a couple of things. Number one, you have to verify it's the right medicine. You have to verify you're going into the right patient. It's the right time to use it, right? You're going in by the right route. So, there you go. And anytime you give a medicine, including oxygen, because oxygen is a medicine, you are changing the physiology of the person, hopefully for the better. Make sure that you note that down. Obviously, fentanyl is becoming a bigger issue in our area, across the nation, and we can't always identify what it is. So we need to make sure we're wearing our gloves on any scene nowadays. If we're exposed on accident, we need to wash with soap and water as soon as possible. As soon as possible. Not hand sanitizer. Hand sanitizer actually will increase the absorption rate and make it worse. If my clothes have been exposed to it, I need to wash them. If it feels like we're in a really seedy part, or if there's a lot of dust in the air in this area, I'm going to put a mask on because I don't want to have this stuff in me causing issues for me. All right, moving on, we have hallucinogens, some of the old type stuff, right? But a lot of people still do this. The PCP, the LSD, all of that kind of stuff. They're going to have convulsions. They're going to have coma and heart and lung failure and strokes with the overdoses. But hallucinogens tell you right off the bat what the main problem is going to be. They're going to be seeing things. They're going to be hearing things that aren't there, that aren't real. And depending on where you're at in the country, maybe even the state, you might be in trouble because they might have weapons or other people that are wigging out too. Got to be very careful in these situations. In the situation where we think that we're dealing with hallucinogen, we want to try to reduce the auditory visual stimulation. I don't need a lot of people walking in and out. I don't need lights and sirens coming in. I don't need flashy things going off. I'm going to be very calm, very chill. I'm going to get transformed. It'll be fine. We have abused inhalants that we can do. Anything that you inhale, anytime you displace oxygen, you can get high because you're putting your brain in a state of hypoxia. And some people like that feeling. I myself like to be able to breathe, but that's me. But people will, the whippets, right? They do that. Or how about spray cans of paint? The heavier the paint color, the more propellant, and the propellant's what they're inhaling. So if I've got gold or silver, the metal-looking paints around their faces, I can pretty much infer that they've huffed these things, and I see respiratory problems, right? A lot of stuff can be bought from the hardwares that can be bad from them. Typically, as we move to sudden seizures and sudden cardiac arrest, that's because they've overdosed and they've hurt their body too badly. But if they haven't gone that far, keep them as calm as humanly possible and give them some oxygen. Support the ABCs. Arrange for. You're seeing the trend here. It's the same treatment plan for the most part. Toxic injection from drugs. Again, they're going to appear to be weak. This could be their normal medicines that they're taking, or most probably it's going to be all of those heroin type things or meth. I mean, you name it. People do the weirdest things to their body. I don't even understand it, but that's the way it goes. Again, support the patient, treat the symptoms, see if I can do anything about the injection or entrance sites. Otherwise, I would just arrange for transport. Basically, we're going to do the same thing all the time. And if they're unconscious at all and you're not sure what's going on, hit them with some Narcan, right? Hit them with some Narcan in an attempt to bring them back to the breathing on their own. Don't judge them. We don't know what's going on with these people, and it's not our place to judge. Our job is to take care of them. We'll see this, the intentional poisonings and overdose. Obviously, these are going to be the attempted suicides, the behavioral emergencies, the things that we may not understand, although more and more all of us are being exposed to it. The emergency treatment plan is the same as those that are unintentional or those that are recreational, right? We need to support these people both medically and emotionally. If that's not you, that's okay. Just make sure someone is there to do that, because the last thing you need is a fight. Okay? All right, let's wrap this up with a couple of little summary notes. Remember that you have these 4 primary routes of poisons, allergens, and medicines to get in. They are ingestion, I eat it in; inhalation, I breathe it in; injection, it's stabbed in; absorption, I bathe in it, it's on my skin. And we need to be thinking about those methods. The only way to use activated charcoal is if it is taken by mouth, whatever it is, and it's non-toxic, right? Meaning it's not an acid or a base or a petroleum product. Nerve agents can be the same or have the same type of responses as chemical insecticides, the organophosphates. We need to make sure that we're keeping everybody safe in the area of a possible exposure there. Pay special attention to the scene safety and do not enter without proper training if you suspect something. Okay, that completes Chapter 11, Poisoning and Substance Abuse.